All right. So everybody, welcome to the workshop tonight. I think we still have a couple of stragglers left, but we're going to go ahead and get started. This is one of those workshops that is, as chiropractors, really easy to do. I mean, this is probably the easiest workshop to put together in a long time. You know, it doesn't really require a lot of thought on our behalf because it's just kind of like, you know, the mundane basics. But that's also because it's kind of our favorite topic, right? So when we look at this I think wraps up the 7 homeostatic essentials, right? So again, based on up above, we've got the 7 homeostatic essentials, and we've covered each one to this point. Physical balance, ironically, was the last one to cover. So if you haven't gone back and watched those other ones, and you want to see how all that plugs in and plays in, go back and watch each of those. And I think, at least as far as the names go, they're pretty close to what you see on the wall. But once again, just to kind of summarize, the 7 homeostatic essentials are the things that your body absolutely needs in order to stay in a state of homeostasis on a regular basis. So does anybody know what homeostasis means? Anybody? Stability, right, yeah. So homeostasis, it just means the body's ability to basically operate at normal, right? So if it's not anything more than just stationary, you know, like what do you need to do to stay healthy? It's like the plant, you know, growing, that you just look at it and it just grows, right? It's just doing its thing. You don't think about it. It's alive. It's been in the backyard for years. You don't do anything about it because it's getting the basics. It's getting sunlight. It's got good soil. It's got nutrients. It's got water, you know, stuff like that. So these are the things like that your body needs in order to operate on a regular basis. And that also means you can't operate without them, right? If these things aren't in normal balance, then your body cannot operate the way that it's supposed to, and you end up in a state of disease, which is really dis-ease, right? If you've never thought about that word before, disease is a lack of ease, dis-ease, right? So that's where we get that term. Welcome. Y'all take a seat anywhere you'd like. Okay, so I'll be starting off tonight. Once again, I'm Dr. Mike, Dr. Jordan, and Dr. Tiffany, and we're all going to be going through little sections here as we move along. So the first thing, you know, when we look at posture, okay, I get this question all the time, or, you know, pose this analogy that posture is really, you guys know, the most important factor of your health. It is, in the research, it's indicated as the most important factor in long-term longevity, right? So if you look at any one factor, you can tell the most about a person's well-being based on their posture. Okay, and so I make this analogy often. You know, if you're watching Animal Planet and you're seeing a cheetah or a lion or any animal for that matter chasing after its prey, what do? Right? You know, you got a cheetah crouching there in the reeds. What does it do? Does it take a social history? You know, does it ask, you know, do you have a family history of dismemberment, you know, or heart disease, or, you know, what does any of that have to do with it, right? If you're a predator, there's only one thing that you have to go based on. You're looking over a whole pack of wildebeest and antelope. What are you looking for? The weak and the fragile. How do you know they're weak or fragile? The posture. That's it. You're looking for the one that's gimping around, right? You're looking for the one that has the limp, that has the awkward posture, and it's pretty easy to pick out if you're a lion or a cheetah, right? So, but ironically, you know, when we look at the way our healthcare system operates as a whole, welcome guys, have a seat wherever you want. When you look at our healthcare system, it doesn't look at posture at all, right? You know, except in isolated circumstances, you know, they'll start to consider it, like, you know, if you're paralyzed, you know, or something like that, all of a sudden, you know, mobility becomes a factor. But outside of that, you go to any doctor out there, and what are they going to look at? Blood work, family history. Now it's genetics. Genetics is that keyword, kind of like AI, that you hear everywhere, where it's buzzworthy. Because the objective there is, if we can show that your blood work or your genetics are the cause of your dysfunction, then it implies there's nothing you can do about it. Therefore, you're at the whim of the pharmaceutical industry and the doctors to get you well, because there's nothing you can do about it. So you must take this drug in order to get healthy, right? Because according to the medical model, only a drug can cure disease, right? That is their mantra, only a drug can cure. Okay, so think about that, the next time you guys are watching Animal Planet, and see what kind of diagnostic skills the animals have outside of posture. Okay, so what does your posture tell about your health? This looks awfully familiar, right? In fact, this girl's probably got good posture compared to what we see in schools, right? I regularly, when I'm talking to parents, when they have their kids in here for their exam, something that always comes up is how kids slouch in their desks, and how it seems like nowadays all the kids are trying to slouch more than the other kids in the room. It's like if you have a certain altitude, you're not cool, right? So, just get down as far as you possibly can, and kind of duck under your desk as much as possible. And so all these kids are killing their lower backs because they're just arching into this non-existent space. Whereas it's kind of weird. I guess maybe I was born to be a chiropractor, because I remember when I was in school, actually pulling out the big thick textbooks and putting them back behind my back, just to support my back, because it was so uncomfortable sitting there like that. I remember doing that all the time when I was young, and that was probably the best use that we got out of those textbooks. They make you carry them around all day and don't ever open them. Okay, so how long, posture really tells you how long-term force of gravity affects all physical structures of your body. Think about that for a second. So the force of gravity is on you at all times. Okay, but it doesn't just affect your spine. It doesn't just affect your knees or your hips. It affects every single structure in your body. I mean, if you think about it, gravity is pulling your heart towards the floor at all times. Okay, well, how is your heart suspended? Inside of your chest, inside of your rib cage. How is your rib cage suspending your heart? With all the fascia and everything else. All of that is suspended around the structure of your spine, right? So the structure of your spine is the most critical component, even for the internal organs, to resist the effects of gravity. Because if you're all bent over and hunched over like this, all those structures are not situated the way that they should be. They're not in an optimal position. Does that make sense? Okay, so critically important to all physical structures, not just the spine itself. Okay, your body's ability to adapt to its environment under physical demands and stress. So anytime this comes up quite often when you look at professional athletes. Okay, one of the things that they do when we're big into soccer, so when a club is getting ready to buy a player for $35 or $100 million, right? That's a massive investment. Okay, do you want to get a player that's prone to injury? No, right? In fact, a lot of transfers, they get cut off because they know that player is injured a lot, right? So they don't want to buy someone that they think is going to miss half the season. Well, how do they determine that? They do what's called a medical. Okay, so right before, the last thing that they do before they sign a contract is they have to pass that club's medical. And that involves a lot of physical activity-based things like box jumps and and stuff like that. But one of the most important things is they put you on bilateral weight scales, right? 2 weight scales on the ground that are calibrated together, and they have you jump up and down multiple times. Jump up and down as high as you can and land on the ground. What are they looking for? They're looking for a moment of impact. Because if you consistently jump up and down and you land all your weight on the left foot all the time before the right foot, what does that tell you is going to happen? They're going to get injured, right? So they're looking for balance, hitting the ground at the same moment every single time. or else they can cut it off. They can say, nope, we're not doing the transfer. Okay, so this is big stuff because it's how your body deals with the effects of just, we're talking physical demands, basic physical demands, exercise, walking, jogging, all any of that stuff, getting up off the floor. Okay, posture tells you your body's ability to absorb outside forces and trauma without damage. What are we talking about there? Maybe car accidents, tackles, things like that are not necessarily normal activities like running and jumping and everything, but they're impacts to the body that you don't see coming. Okay, so if we're dealing with a car accident case, for example, sometimes the insurance adjusters on the other side will be like, okay, well, the patient had a back injury or a neck injury before, so, how can you say that this car accident was related to it? And our answer is very simple. Well, it doesn't matter if it was or not, because if you have a choice between being injured before a car accident or not being injured before a car accident, which would you rather be? I'd rather not be injured and take a hit, because if I'm already injured and I take another hit on top of that, who's more likely to be injured even further? So it's a moot point, right? It doesn't make any sense at all. Your body's ability to absorb outside forces and traumas is dependent on those shock absorbing capabilities of the body and the flexibility of the body. I mean, you think if you take a newborn, or not necessarily a newborn, but a small child, had a pair of parents here earlier today, and they were saying how their kid falls all the time and everything, right? You guys see that? They fall a lot. And I was like, yeah, but if you really think about it, we have a distorted view of that because we're a lot higher off the ground. So what looks like, oh my gosh, they're falling, they've got to be hurting themselves, they're really only that far off the ground. I mean, they're not falling that far, and they don't have nearly the momentum that an adult body has when they hit the ground. And on top of that, their bones and everything are a lot more pliable. They're not hard. All the connective tissue in their body is a lot more pliable and everything. So, it's really, they're kind of like jelly just hitting the ground. It's, unless they mash their skull or something like that, it's just not that big of a deal, right? But we have to deal with all that stuff somehow, and that is all dependent on posture. Okay, last one, posture tells you your nervous system's fluid and electrical function, which I think one of you guys are going to go through that more in detail, so I won't touch on that too much, but therefore the health and function of all tissues of your body. Because if the nervous system, if the posture regulates how cerebrospinal fluid flows and how electrical activity works inside of the nervous system, well then therefore it affects your stomach, your liver, your kidneys, and everything else in play. Okay, so we see a patient that has digestive dysfunction, but they have neck problems. Well, we're like, well, of course. I mean, by law, you cannot have, digestive dysfunction and it not be related to the neck pain that you're having. It's just, that's just a no-brainer, right? Okay, so all of these things are dependent on your posture being normal. So it's pretty important, right? So what is normal posture and why? This is what a lateral view of the spine is supposed to look like. Okay, the ideal weight-bearing curve in nature is 45 degrees. If you guys look at any stable structure in architecture, they tend to use 45-degree angles for windows, for arches under bridges, the Hoover Dam, all of those are typically in arches because they absorb impact. Okay, look all throughout nature and all throughout architecture, and you're going to see this everywhere. Whereas if you have something straight, how does that absorb impact? It doesn't, right? It's not designed to absorb impact. So your body, the better your curves are to a certain point. I mean, you don't want to be completely folded over because then that's too much leverage on the inside of the curve, right? But there's that optimal point, and not surprisingly, science has confirmed 45 degrees is the perfect structure in the human body, in the human frame. And what's really cool is when you look at the whole system and you put a mathematical model on there, the Pedibond system teaches us that the whole spine is built on 30, 60, 90-degree triangles. So it's all geometrically perfect when it's in its natural position. How many people do you think are in their natural position? It's sad. It's very, very sad, and that's because of our level of activity. Okay, so the ideal weight-bearing curve in nature is 45 degrees, which happens to also therefore be ideal in the human spine. A plumb line, as you see here, should drop straight down through the spine, through those three curves, transecting them perfectly down the middle, so that it's not weighted too far forward, it's not weighted too far back. That's because gravity is a straight down force, right? So you're going to be able to most absorb shock when those curves are stacked on top of each other so that they can compress like a spring, right? Okay, so you've got the cervical lordotic arch, you've got a kyphosis in the thoracic spine, and another lordosis in the lumbar spine. All those should be balanced perfectly around that plumb line. Okay, normal posture has very little to do with chest, head, arms, shoulders, etc. All of these are secondary factors, often confused by others because that's all we see. Okay, this is a big factor in healthcare, you know, when you talk about what you see. I explain this all the time in a simple analogy. Isn't it funny how many women, for example, would go and get a hysterectomy? Okay, or how many people will get their appendix taken out or their gallbladder taken out, and they don't really think about it, right? But if you had a wound on your hand, and the doctor said, we actually need to remove 2 of your fingers, how seriously do you think you guys would take that? Very seriously, right? Because your hands happen to be in front of your face all the time. Okay? So we have almost an obsession in healthcare, Western medicine as a whole, that health, you know, it only really matters if you can see it or not, right? If you've got a scar on your back, it's not as big of a deal as if you have a scar on your front, simply because you can see it, okay? Really think about that. So when we look at posture and you look at all the different, I mean, I'm sure if you got on YouTube or TikTok or whatever and you look at all the posture related stuff out there, everybody talks about, you know, shoulder position and arm position and hip position and all this other stuff, but all of those things are secondary. When you've got good spinal curvatures, those things do what they're supposed to do. You don't have to think about them. They just automatically fall where they should be. Okay, the fact is there is one optimal, and anything less will have compounding physical effects on the body over time. Okay, so we talk about what optimal looks like, and realistically, everybody kind of wants to achieve optimal, but what level of work will go into achieving optimal really is a wide range of variability, right? You know, people will do different things, you know, in terms of how much effort they're going to put into fixing that. But we all have to understand that there's only one optimal. You know, it's not, you know, we'll hear from people once in a while, they'll say, oh yeah, you know, my doctor, he saw that I didn't have much of a curve in my neck, but said that that was just natural variability. I'm sorry, no. It's just, that's just wrong. That's like saying scoliosis is normal in a subset of the population, but it's not in others. No, it is a deformity, period, if it's not sound according to basic principles of mathematics and physics, right? The body is designed in one way, you know, so it really should be a very close approximation to that. Anything that's not that, you developed into. So common is not the same thing as normal. Does that make sense? Right? So something that's common doesn't necessarily mean, oh, we should just disregard it because, you know, it's normal. That's what we see in the population. So when they look at blood work and you see that, you know, the average blood pressure is so much, or the average number of red blood cells is so much, or cholesterol levels is so much, you know, that's based on a population. You know, they're looking at the whole population and kind of getting what they figure is normals. But if you look at the whole population and everybody's necks are screwed up, you can't assume, well, that's what normal is. We have a mathematical model that proves otherwise, okay? All right, next one here. Oop, wrong button. Okay, so what happens when posture breaks? Okay, when I mean breaks, I mean you're breaking the laws of physics here. Okay, so a couple things happen. For every centimeter of forward head posture, the weight of your head on your neck increases about 10 pounds. So if you have just 2 centimeters of forward head posture, that's going to add about 20 pounds of additional leverage to your head, okay, physically on your neck. It's the same principle, okay, and all this is because of gravity. It's the same principle if you hold a bowling ball on your shoulder and then you take that same bowling ball and you hold it out here, okay? The effective weight at your shoulder is very different from here to here, right? The bowling ball, nobody's questioning, that weighs the same, but the leverage on your shoulder is radically different, right? So all it takes is 1 centimeter forward, and how much does the average person's head weigh? About 10 to 12 pounds. So that means 1 centimeter out, and you're carrying an extra head. So, you know, when we're explaining this, I ask people a lot of times, you know, if your head is out 4 centimeters and your head is effectively weighing 40 pounds, think about it outside the box. What if I were to give you a 40-pound helmet, or I give you a 40-pound child and tell you, here, hang this child on your head and walk around all day and see if it has any effect on you. And we wonder why we have neck pain, right? So we've got to fix forward head posture because it is that destructive. Losing the curve in your neck stretches your spinal cord, causing spinal canal stenosis, which alters CSF flow. Again, they're going to talk about that a little bit more. But losing that curve, it's just like the skin on the back of my hand. It physically stretches. And when you physically stretch that curve, you shut off cerebrospinal fluid flow through the spinal canal. All right? The weight of the head forward further rolls shoulders forward, causing depression of the heart and lungs. So naturally, when your head goes forward like this, you sink in. Do you know that there are studies that show, obviously, that if you walk around like this, people tend to feel more depressed? And likewise, if you are a depressed individual and you make an effort to pull your shoulders back and your head back, your level of feelings of depression will actually reduce. Because it's that compression on your heart and lungs that reduces oxygen, that reduces your ability to breathe deeply, which reduces, you know, all of this other stuff that's going on systemically, right? So posture definitely has an effect on even beyond and mental issues. Disc spaces in the cervical and lumbar curves, when lost, are pushed posterior, causing disc bulges. So think about this situation. You know, their head is bowed forward. All that pressure is pushing out the back. The disc spaces aren't supposed to go back. When you compress, the disc spaces go anterior. So you put the head out like this and you compress, all that pressure is going posterior. That's where do disc bulges and herniations always happen? Posterior lateral. Okay, you bulge a disc in your lower back, it's posterior lateral. You've got people that can lift hundreds of pounds over their heads, weightlifters, and they don't blow discs anterior. Think about that, right? So you've got to keep those normal curves. In fact, there was a study done that showed if you have a normal lumbar curve, less than 10% of patients will have any kind of disc bulge or herniation on MRI. Okay, but if you lose the lumbar curve, 90%, no, actually I think it's 5% and 95%, it's even more dramatic. 95% of patients would have disc bulges or herniations on MRI, even if they don't feel it and have any symptoms. So you're literally guaranteeing that you have disc bulges if you don't have that normal curve, because it's just physics, right? It's just the way that it should be. Okay, weight on the lower back is arched posterior, right? Look at this one here. See how their belly is sticking forward, right? All of us want, you know, our belly to stick forward, right? Nobody wants that, right? So, but we got to understand a lot of that is caused because of the position of the pelvis. When your head goes forward, your pelvis goes forward with it. You want to reduce the belly and how much that sticks out, you pull your head back, the pelvis goes back with it, and it flattens all that out, right? So weight on the lower back when it's arched posterior, it causes limbo force on the lower discs and the SI joints, right? Anybody ever do the limbo? Yeah, right? So you're walking around like this all the time. You know, when it's not that aggressive, but it's the same thing. It only takes, you know, maybe 5 degrees back, and you're adding significant force to the lower back, the lower discs, and the SI joints. And that is every day you're walking around like that. Do you think that's going to progress and cause increasing back problems? Right? So it's not surprise that something like 95% of the population has back problems by the time they're 50 years old. Right? With the pelvis forward, abnormal mechanics to the hips, knees, ankles, and feet are applied, causing many related mechanical failures. Flat feet, bunions, shin splints, knee problems, all of these different things, they're all related to the position of the spine. You know, I'll explain it oftentimes that, you know, if anybody's ever played basketball, you know, especially guys, you know, you play basketball and you catch a ball in the wrong spot, what happens, right? You tuck your pelvis back and your toes go in, right? So when your pelvis goes posterior, your toes tend to go in. When you push your pelvis out, your toes go out, right? So when you see people walking around with their toes out like this, it's because their pelvis is out in front. So your feet should be parallel naturally. If they're not parallel naturally, that's because your pelvis is pushed forward. It's secondary to position of your head. So pay attention to foot position. All right, and that's you, my friend.
Cool. You said down to go forward?
Yes.
All right, guys, I'm going to change gears a little bit. Like you introduced, I'm Dr. Jordan Moore, and I'm going to be talking a little bit more about to begin with, some basics about movement. And we'll start with looking at the number of joints in the body. It's actually more than the amount of bones that we have in the body. And so there's some debate here. I've read from 300 to 400 plus movable joints within the body. I think 360 is a good estimate. There was a Chinese source that said there was 365, which is kind of cool because that's how many days are in the year, right? But with each one of these movable joints, you have 3 main components. You have an agonist, you have an antagonist, and you have synergist. So my example here, we got the elbow, and everyone knows the bicep, right, flexes the elbow, so that's the agonist. The antagonist, the muscle that relaxes, will be the tricep. And then you have a synergist, which is a muscle that just helps, so like brachialis over here. And then vice versa. So if you're going into extension at the elbow, the tricep becomes the primary mover, or the agonist, then the bicep has to relax. And then you have a synergist like the anconeus, would be a muscle. This is important because this is the basic way to look at movement between muscles. When you have one flex, one has to relax, and vice versa. This can contribute to things that we have listed below, like tone, taut fibers within muscles. He mentioned fascia. A little bit more about that. That's the soft tissue covering that goes around the whole body. It connects to organs, bones, muscles, and it's highly innervated, and it plays a more major role than conventional medicine typically used to believe. We have these, we'll talk a little bit more about spiral lines and how the fascia connects to everything in the body. But the position of bones, previous injuries, trigger points, everyone knows these. When muscles have an injury, they tend to heal in a little bit of a mess. If you've ever gotten a massage, they've worked out probably trigger points. And they can all affect your joint position. And so we're essentially accumulation of our lifestyle. A simpler way to put that. And with that comes the idea of tensegrity. I had no idea about this concept until chiropractic school. We had a professor that was very obsessed with it, but we learned a lot about it. And instead of thinking of the body like this physical stand-up, upright structure that resists gravity just from the bones alone, you can think of fascia and ligaments and tendons all pulling at bones from different angles to keep us upright. And it's an interesting concept because if we were built like a wooden pole and we had enough force, our whole body would just snap, right? but we have a lot of give within the bones because of these this concept, integrity. And so it is a combination of tension and integrity, and you can think of the bones providing us with discontinuous compressive support, while the soft tissues provide tension on those bones. And it's a pretty cool little model on this right side. Someone had built a table, I believe this is a drawing of it, but it's got a piece of rope connecting, so from this structure down, supporting the weight of the above structure, and then some ropes keeping it from toppling over. Pretty cool. And some real world examples of integrity here. You can see on the far right, that's in DC. That is the Needle Tower at a museum. You've got the International Airport at Denver, some other places like the Olympic Stadium in Munich, Biosphere in Montreal is pretty cool. And then the NASA Super Ball Bot, it looks just like this with a bunch of ropes connecting, but it actually provides a lot of movement or resistance against crazy movements. It won't snap, and it makes it really strong. But with the joints, we're looking at two different positions. And so I have an image on the right here that shows the knee, and the knee is straight here and flexed on the right. And it's two different ways of looking at the joint. When it's straight and bone on bone per se, it's what we call a closed pack position. There's not a lot of give in that joint. It's strong, but also if you overload that joint, you're going to injure it. ACL, PCL injuries there occur at knee flexion. Same thing with the shoulder. If you think about the shoulder, with it out here, this is called a closed pack position, more bone on bone, surface contact here. You overload the joint here, you're going to dislocate forward. Versus the loose pack position on the right, a little bit of knee bend, and you have what's called joint play. The joint can move a little bit freer. Same thing with the shoulder out here in front. You can resist a little bit more motion here. It might not be as strong, but you're less likely to dislocate once you're out in front. Both positions are needed. Too much of either can cause both degeneration and an overstrengthening of the surrounding area. And this concept of adaptive shortening can apply. If you overuse, let's say we're sitting all day, is a good example. So your hip flexors are contracted, your glutes stretched or relaxed or inhibited. Your body will be like, this person's sitting all day, their body demands it, we have to adapt to their lifestyle, and you'll actually have the muscle physically shorten. And then a shortened hip flexor connects to the low back. We pull out the low back when we demand use of the hip flexor, and so that's a common cause of low back pain. We see that a lot. But so muscle imbalance in the joints is a common cause of joint dysfunction, and this can be any movable joint. Like I said, the 360 plus joints includes joints at the spine, obviously elbows, knees, things like that. So how does imbalance occur? I mentioned sitting. There's some other things like macro traumas, car accidents, sports injuries, surgeries. Micro traumas, these will be sitting all day, texting, constantly stretching the muscles in the back. Like this example on the right, there can be, if you're one-sided dominant on an activity, you're a golfer, tennis player, really countless, sitting on the left seat, with one hip hike every single night watching TV for an hour or two, your body's going to adapt to whatever you demand of it. And another concept, if you don't use it, you lose it, right? Not only do your muscles adapt with the adaptive shortening, but you'll actually lose nerve supply, and you'll lose blood supply as well. And so reciprocal inhibition, that's if you use a muscle, the opposite one relaxes. If we're constantly using our hip flexor while we're sitting, we're going to be constantly losing the muscle tone and the ability to activate our glutes. So it's all about balance here when it comes to joint position. And unfortunately, a lot of our lifestyles in front of us, keyboards, phones, we're constantly demanding our pecs, which means we're going to have stretched rhomboids in the back, constantly demanding our neck forward, right? So these are getting overstretched back here, our extensors. And of course, with the forward head posture, rounded pelvis. It's typically what we see. Very, very few times I've had patients with hyperlordosis in the low back. It's usually they've lost their curve in their neck and low back. So common issues we do see. We could have muscle tone due to spinal subluxation. So if we have someone in distress and their low back has lost curve, you'll have back spasms. We have slip discs. That's an extreme example. the muscles are going to tighten. We'll have patients say all the time, I think it's just a muscle issue. It's just a muscle in my low back. We had someone at soccer playing with us Sunday, and I was like, you need to come see us. And he's like, oh no, it's a muscle spasm. Well, the muscles are innervated right off the spine, right? The muscle spasm could be a symptom of something a little bit more serious, something going on with this low back. We have sciatic nerve compression. That can be due to a muscle here called the piriformis. It can be due from a slip disc or subluxation in the low back. It can be due to tight hamstrings. We have forward head posture we've talked a lot about. The knee problems. A lot of times I see patients come in with knee issues, and the knee is an extremely resilient weight-bearing joint that when we sit and we overstretch the muscles in the front, we tend to adapt, and it tightens up to the point where we have tight IT bands and tight muscles on the outside pulling the kneecap outwards. I'm pretty familiar with that because I've experienced it. What got me started as a patient was what he had mentioned earlier, when the pelvis tucks, your hips go out. I had torn, in 2010, my ACL, MCL, and meniscus on the left side. And then 2 years later, because I didn't address the issue, which was the pelvis, I tore a meniscus on the right side. And so I thought I'd never get to play soccer again. Became a patient here shortly after. And I had a negative 13-degree curve, so it was literally going this way, right? And completely shredded my knees. I was able to restore that curve. We're, pretty close to normal now. But the medical side of things never made me aware of the root cause of my issue. So thankful for that. And other things we've seen, pelvic obliquity. Look at this example here. So sitting on your wallet. That's a question I ask every male patient I see. Typically, if they have pelvic tilt on one side like this, or pelvic obliquity, you'll have them sitting on a pelvis. It's acting as a wedge. That person is telling their body, or telling their brain, hey, we're going to be sitting on an inclined slope often. The body's going to tighten the hip flexors. It's going to stretch the other side hip flexors. Typically you have that as well as some rotation as well. So you have a functional short leg and a functional long leg. So now you have uneven pressure on the knees and ankles as well. I'll tell some patients, if you're, just put it in the other pocket for a little bit and then ditch it all together once we get you straight. When strapping the backpack, for example, that will also cause you to elevate the shoulder, tighten up here in the traps, turn the head toward that side. Patients with scoliosis as well, we can use a shoulder weight. I've had some where I've instructed them to actually walk around the house on the opposite side to help curve the head toward the correct direction. And this third example down here, this is what we call bicipital tendinitis. So with forward head posture, coming forward, typically the shoulders round, you have two grooves, or you have two bumps and then a groove in between. The bicep tendon here runs right in between it. And if we're constantly like this, we're training the humerus to sit internally rotated, is what we call this. We're stretching all the muscles in the back, they're getting weak. And every time you use that bicep, you'll see guys in the gym that'll bench press and then go over there and stretch out their arm, right, because they're having pain in the front. You'll see people doing push-ups and they'll have pain in the front. They've already overtrained their humerus to sit in, and they're doing further training through pushing. That's making it worse, so they're just shredding their bicep tendon constantly, right? Had a couple patients with this. This one's pretty easy to identify, and chiropractic helps a lot with this, increasing mobility in the thoracic spine. But that's educating the patient of the problem so they can start stretching the pec and tightening up the back. They'll have the issue until they start doing these steps, right?
We've even had patients snap one of the heads of the tendon.
The bicep tendon?
Yeah, it just gets to the point where that just snaps all together and then it's all done.
Yeah.
It's fine, you got two connections. You'll be fine. Your bicep will just look funny.
Yeah. Some other things I've mentioned here, ankle sprains, typically due to muscle dysfunction, scoliosis as well. You have curves in the spine, so you obviously have tight and then inhibited muscles on the opposing side. Lazy eyes, actually, we don't treat that right. We can educate the patient on the cause. But typically it's one muscle just not wanting to do its correct job, right? Not focusing. Eventually, if it's not corrected, they do lose vision. So that one can be seen as well. So, what are you demanding? I want to make a point, movement is life, both from a macro and a micro perspective. So inside the body, transport of nutrients, things like that. You're breathing, you're not thinking about that. You have small muscles in the base of the skull that adapt based on what you're looking at, where your position of your head is, and a macro perspective. So this is you're sitting on the sofa, or your muscles are adapting to your lifestyle. So what are you telling your brain and your body if you only train one muscle group? And this can be intentional or unintentional. Like tennis players, weightlifters who go to the gym only on Mondays and it's International Chest Day. If you're only training a certain group of muscles, you're telling your brain, this is important to my lifestyle, my survival. We need to strengthen this area. We need to adapt to whatever's physically stressing this person. And that could be sitting. If you don't move at all, you will have muscle atrophy. You can see on the example here, the muscles not being demanded, or you're not demanding anything of the muscle, and it's muscle maintenance is an expensive thing to the body, and it'll allocate the resources elsewhere, right? So what we need to do is demand growth. So besides the mental benefits, there's tons of benefits of moving. There's tons of benefits of working out. Improved confidence. They say that working out's more effective than an SSRI or antidepressant medication. But it also strengthens the mind-body connection, the nervous system, between the brain and whatever action you're doing. Another word for this is muscle memory, right? So you can teach your body to be good at certain activities. The more you do it, it's through that brain-muscle connection. You'll also have improved load capacity, just another way to say you'll get stronger. You'll have improved endurance as well of the stimulated muscles. Structural remodeling of the vascular system to support energy demand, so you'll have actually improved blood flow to the area. Of course, you're using the muscle more, it's getting stronger, it's using more resources. The brain's like, okay, we should provide it with more oxygen. We should give it more glucose to help glycogen stores and things like that. Last, improved stability and resilience from injury. Dr. Mike touched on this as well. That tensegrity model, if you have strong soft tissues, which do strengthen an end range of motion of joints, you can strengthen your soft tissues. It's called Davis's law. We touched on that, I believe, in the spine-wise exercise one that we did. And then also Wolf's law, you can strengthen your bones as well. And this is, think about Muay Thai fighters who pick banana trees to strengthen their tibias. If you impose a demand on the body, it's going to strengthen that. It's going to make them more resilient to injury. And I believe that is it for me.
Thank you. Okay, so excuse me, we're going to go into now a concept or a term called proprioception, and that's your body's position, sense, and space. So this is how your body knows where you are, so the sense of position, location, orientation, and movement of the body and its parts. So we'll go into that in just a bit. So I like to say it's knowing where you're at and where you're going. Proprioception is the input received from the sensory components of your body that tell you where you're at so that you can continue to perform movements, protect yourself from injury, and also so that your body knows where to allocate resources. So you have proprioceptive, you have receptors in all of your joints. You also have them in your muscles. We'll talk about that in a few minutes. But that's how your brain can see that your arm is out to your side, palm down, or by your side. If you were in a dark room and your eyes were closed, your brain knows a map of your body. So that's the difference in catching a cell phone that someone's throwing to you from across the room versus dropping it and letting it hit the ground. If your body can't accurately perceive where your hand is by your side, it can't accurately put your hand out where it thinks the phone is going to be, and you're going to miss it, and your friend is going to be really upset with you, right? So I like to illustrate that here. So it's knowing that your hand moved from your side to being raised above your head, slightly in front of your body, holding 3 fingers up while the thumb holds down the 4th finger. Your body is constantly receiving that level of specific input so that it knows what your body needs to do. So as our bodies respond to subluxation, which is that abnormal motion in position of the spine causing decreased function, we don't receive quite the accurate input that we want. So whether that is your spine not moving appropriately, your shoulder not moving appropriately, you're not going to get good input in. And that's why we adjust, to wake up that brain-body connection so that we can put the correct posture in, so the joints are in an optimal position, and the joints that are connected to those joints are also in the right position and can move accurately and receive accurate function. One good example of this is carpal tunnel syndrome. Whenever we see patients with carpal tunnel syndrome, they come in and they're like, I've also got carpal tunnel, but don't worry about it. I'm gonna have the surgery. You can't do anything about that. My neck pain is the problem, right? Well, if your neck is like this, then your shoulder is rolling forward, like Dr. Jordan mentioned. Your elbow's not moving properly, your wrist is not moving properly, and when you're typing at your desk all day like this, all those joints don't get the right motion they need. And your body's getting bad input, so it doesn't know how to fix that and do it appropriately. And that reduces injury and allows for more accurate movement. So I put a paper, just abstract up here, about fall risk in older people. And there are actually studies in chiropractic about this. Whenever we adjust the spine and get that accurate brain-body connection flowing, elderly people are less risk of falling. And you know, the older we get, a fall can be detrimental. So if you're getting good information from your ankles and knees and hips, you can place your feet where they need to go appropriately. Or if you stumble on something, you can recover from that movement better than if your joints weren't moving like they should. Okay? And so then we have a similar concept. So that's the muscle stretch aspects. We just talked about the joint. And I said same but different, right? Because it's muscles telling us now what's going on. And so we have sensory reporters in our muscles. When our muscles stretch, our brain also receives information about that movement. So we know that the biceps contracted to move the hand closer to the body, and the triceps relaxed to allow that. And then our muscles near the spine also reflect what our body's core is doing. So we know that we're leaning one way or the other, so that impacts our balance. And it tells us, weakness. So if we need to compensate for something, we're pulling other muscles in to do that job. And the suboccipital muscles here are important too. Neurologically, they have a great impact on the body. They can contract muscles further down based on the position of the head. So adjusting near this area is important for stability and balance. And so what happens to your body if you don't send accurate information? That's what we talked about. More falls, more dropped phones, maybe burned hands on the stove. And that's also why it's important to get our kids adjusted. Kids need to be able to develop this accurate body position sense as they age, so they don't develop the movement patterns that lead to those breakdowns. And then we'll switch gears into the craniosacral pump. So we have a fluid that covers our brain and spinal cord, Dr. Mike mentioned earlier, called cerebral spinal fluid. I'm going to shorten it to CSF because I'll choke on that all day long. But CSF is created in your brain, and it serves several important purposes. One, it's a coolant for the brain and spinal cord, so it actually regulates temperature. It works in waste removal, so removing toxins from our brain and spinal canal. It delivers nutrients to the brain, spine, and nerve roots. And it acts as a chemical and a physical barrier for the brain. Excuse me. So for chemical barrier, it regulates pH, makes sure that we are not getting nasty things in or letting too many good things out. And for the physical barrier aspect, it creates a little bit of buoyancy for your brain and your cranium. So if you were to stumble and trip this way, your brain's not going to smack into your skull, and then you're not going to have a bruise and a hemorrhage and all the things that happen, right? And it does the same thing for the spinal cord, giving you a little bit of cushion within the spinal canal, so your spine doesn't hit up against your vertebrae or your body. So CSF washes over the brain and spinal cord within the subarachnoid space. That's just underneath the tissues that cover the brain. And then it drains back into the superior sagittal sinus, which is one of the main veins that drains the head into the neck. So your CSF actually will partially return to your venous blood return in the body for removal. And we turn over our CSF 3 to 4 times per day. So it's important for that system to continue to pump through new CSF to deliver nutrients, remove wastes. And down here, production responds to pressure. So your brain will actually produce less CSF if it feels that you have quite enough, or if you're running low, it'll produce more to make up for that.
So what is that in ounces? Milliliters?
I believe it's like 150 milliliters on average is contained in the system at a time, but you produce about 450 per day.
So how do you build it up if you've been overheated?
Well, your body will do that for you, so it's all pressure. So if it feels that you have plenty of CSF in the system, then it'll add more. It's not necessarily going to respond to temperature. It just provides that kind of safe temperature zone for your brain. So it doesn't flow in a circuit like our blood does. You know, blood leaves the heart, pumps all the way through the body, comes back through the veins to the heart to be reoxygenated in the lungs. CSF actually moves more with the flow of gravity, so it's pulled down into your lumbar and sacral region. And it being created in the brain also kind of pushes it out and down into the spinal cord. And then subtle movements of the skull up here in the sacrum, the lowest bone in your vertebral column, create that movement as well. So as we inhale, the base of the skull moves forward and up, while the sacrum moves backward and up. And then as we exhale, they do the opposite. Now, even still, as a chiropractor, reading those means nothing to me. So we're going to look at this. What happens is when you breathe in, your skull is going to move forward like this. So as if you're jutting your chin out and up. That's how the base of the skull moves. And then your sacrum is going to move down as if you're moving your pelvis down like that. And the opposite happens when you breathe out. We're going to move up. And the sacrum is also going to move up. Now, these are very minute movements. So you're not going to see, someone's head going like this when they breathe. It's going to be very, very small. And actually, we're taught, for as long as I can remember, that the skull bones fuse as you age. And so in my reading, I read that it starts about 20 years old. And then by the time you're in your 40s, your skull bones have completely fused. But there is a little bit of play there because the tissues that grow over the brain will actually kind of protrude out of the sutures, the little places in the skull where those bones connect together as we age. And that gives us just a little bit of tiny movement. Some people say they can perceive it. There are actually osteopaths and craniopaths and then chiropractors who also practice with cranial movement. But those bones can be slightly shifted out of bounds or whatever, creating tension on the dural tissues that cover the brain and the spinal cord. So when that happens, we have an abnormal pump of that CSF, and that can cause things like impaired cognition. It can cause inflammation because you've got the waste staying stuck in place rather than moving and delivering nutrients. And it can also, people report brain fog or headaches, things like that, with a CSF stagnation. So by moving those yourself, you can increase that pump just slightly and see improvement in those symptoms. And then also bathe your nerves so that you receive better nutrition for them and better function from there. So the way I like to do this is I like to teach patients, you lay on your back, get in a comfortable place, and then you're going to use your breathing, which also moves these, to accentuate the movement with yourself so that you can pump the CSF through. I have a lot of patients who will report brain fog, and I'm like, okay, go home and do this a couple of times a day and see if you can see an improvement with that. I do it for myself. So you'll lay nice and comfy flat on your back. You'll breathe in really deeply, very slowly, and you'll point your nose up toward the ceiling or up toward the top of your head, and you'll do the same thing with your toes. So nose and toes up, and then as you breathe out, you'll point both of those down, and that's going to replicate the action of your cranium and sacrum so that you can pump your CSF through. Now, when our spine is poorly adjusted, when we have poor posture, we don't pump that as efficiently. So getting adjusted, but also just working on getting your spine into a more relaxed place is going to help that. And then like Dr. Mike mentioned earlier, when we straighten the curves of the spine, we straighten the tissues that surround the brain and spinal cord and decrease the diameter of the spinal canal. and that too can slow down the movement of CSF. And then that tension on these structures can reduce that movement as well. Okay? So get adjusted, physical balance, but also just be aware of how these things move. And then I also like to mention when we sit with that forward head posture, think about how hard it is for your body to flex your occiput, the base of your skull, forward. So just by holding good posture, you're allowing for better mechanics of that process that you shouldn't have to think about to occur. Okay? And then last, continue.
One more thing here. So we all kind of, we look at all this stuff, and you guys understood all this stuff as far as posture goes, and you know it's important now, right? So the next question comes, how do you fix it, right? If my posture isn't where it should be, how do you fix it? That's always the next relevant question. And, the straight answer, honestly, is getting adjusted is not the answer. Okay, ironically, that's like blasphemy for chiropractic, right? Oh my gosh, don't tell patients that. No, it's getting adjusted. We tell patients all the time, getting adjusted is important to be able to move, to be able to change the positions and everything. If you're locked here, and the bones won't move, how are we going to get you to the point where you're flexible enough to be able to adapt to a new position, right? You can't. So at the same time, we'll have patients, we run into someone that we haven't seen in a couple of years, and hey, how you doing, and everything else, and they'll be like, but I'm still doing my home care, right? It's kind of funny, inside joke, that how guilty patients feel, when they haven't seen us for a while. It's like they avoid, you'll see someone in a grocery store and they'll be like, and go the other way, and it's like, I was just gonna say hi. Like we're not, we're not gonna try to talk you into coming back under care in that moment. It's good to see you, but the reality is even if you say, okay, well, I'm still doing my therapies, but like I said, if you're locked in position and things are subluxated, then you're still not really able to adapt the way that you should be. So it's a combination of the two that really makes it work. But you're not going to do that just by getting adjusted alone. Okay, so how do we fix it, right? The age-old, well, stand up straight, right? Well, you understand now, looking at all this stuff, standing up straight means a lot of different things, right? Someone that has significant forward head posture, they say stand up straight. That's standing up straight to them, right? Or if they're like this, stand up straight. I mean, there's so many different things that could mean, but that doesn't mean it's right. Okay, so we've got to look at what that means. The problem with this logic is that it requires conscious effort. So let me ask you this question. Do you sleep better when you think hard about it? Right? If you really think hard about it, you'll sleep better, right? I'm really going to focus on being relaxed while I'm asleep, right? That doesn't make any sense because sleep is a unconscious effort, right? It is dependent on subconscious activity happening. In fact, guess what determines heart rate, rhythm, and respiration, the vital functions that happen while you sleep? The brainstem inside of that upper cervical curve. So yes, posture even affects how you sleep and the basic functions that keep you alive while you sleep. So, how many people go and do sleep studies all the time? Right? When they're told that they need CPAP machines. But how many of those people that are selling them CPAP machines are asking them, well, how are you sleeping? Are you sleeping on a pillow? Do you have 2 pillows? Do you have 3 pillows under your head? That's causing your forward head posture like this while you sleep. That's jacking up your upper brainstem, causing compression. That's now affecting heart rate, rhythm, and respiration, causing you to snore. Of course they don't. Here's the machine. We're just gonna push oxygen into your nose, right? And that's gonna fix your problems. So you've got to deal with posture from a subconscious level. It can't be conscious. Posture is largely controlled by involuntary muscles of the spine. They're not the voluntary ones, right? How many of you, as you're sitting here right now, are thinking about the individual contractions of your muscles in between the T6 and T7 vertebral levels. Absolutely. Right? I've been concentrating on that one the entire time. Right? No. I mean, of course you don't, because these are involuntary muscles, right? They might cause you discomfort, but the reality is, here's a really crazy part when you think about it. Who in here has had a little bit of discomfort having to sit in a chair for an hour? Oh, yeah. Right? You know, anytime you have to sit like that, you have to fidget, move a little bit and everything else. Do you know that most of that discomfort is actually the voluntary muscles? You're not feeling discomfort within those involuntary muscles. It's the big ones, right? It's your trap muscles. It's the ones that you can actually control. But you ain't controlling the involuntary muscles in your spine. Those are doing their thing. They're perfectly fine. They don't even think about it. It doesn't faze them. Those are muscles that are designed for long-term contraction. They're like steel cables in there. They can hold position for ages, right? And not be affected and not have pain. It's the voluntary muscles that typically cause us pain. But these are the ones that we actually have to affect if we're going to change posture. Crazy, huh? Okay, so in order to change involuntary patterns, you won't do it via voluntary actions. You don't do it by just saying, I'm going to stand up straight like this all the time, right? It must be subconsciously trained, because you can say, okay, well, I'm going to stand up like this, and then your wife yells at you, huh? Right? And then you go right back to default. I didn't mean yell in a bad way, of course. Nobody does that, right? So it has to be subconsciously trained. All right? We train the subconscious brain by adaptation through sustained applied force. Okay? So think orthodontics, right? You go to an orthodontist, and what do they do to fix your teeth? Do they tell you to, we want you 1,600 times a day to take your tongue and push against your front teeth? Or just think really, really, really hard and, contract your gums, and you're going to, no. How do you do it? You put braces on the teeth that are on there how long? 24/7 for 5 years, right? Whatever it is. It's that sustained applied force, but it's not like they just, rack them in and just force it into place like they do scoliosis surgery, right? Think about scoliosis surgery. They don't do it like the orthodontists do. If you've ever seen that done, they literally are filleting kids open like a fish and then screwing with a drill like you have from Home Depot, right, into the spine, and then putting in these giant rods, big metal rods, and they'll put them in there, and then with all of their force standing around there, twisting and forcing the spine where they want it to go using absurd amounts of leverage. And then someone else goes in and puts screws in and everything to lock it into place while they're holding it. Okay? So imagine if you did that with teeth. How many people would want braces? How many people would want their smiles fixed? It's absolutely absurd what they do with scoliosis. And it doesn't work, by the way. Okay, so this is what you have to do. You have to sustain applied force over, what is the magic component? Time. You can't force it in a short period of time. You're not just going to change and fix your spine in a matter of weeks. You're not, right? For some people, it takes many, when we ask, patients will ask, okay, so I'm starting a corrective plan. How long is it going to take to fix my spine? And you know what our answer is? We have no idea. Because why? Because we don't know how much time you're going to put into therapy, into correction, right? That's dependent on you much more than it is on us. But we know that sustained applied force over time is going to have an effect. And that's going to happen every time. 100% of the time, applied force is going to have an effect. It's just a matter of what that takes. Okay, so most every single posture device on the market today is some modified angel wings brace. Okay, if you know what I mean by angel wings, when kids dress up for Halloween, and they got the big wings on their back and everything, it's just basically 2 loops of elastic that you put around your shoulders like a backpack, right? So if you get on Amazon, you get on eBay, you get on any website out there, pretty much every posture device out there is some form of that. It's just shoulder straps, okay? And some of them are fancy, some of them literally are just an elastic strap in the shape of an 8, right? And then they've got other ones that are, the fancy ones, recommended by Amazon, and it's like faux leather in, basically the shape of your back. But guess what? It still just has shoulder straps. So all of those are designed to just pull your shoulders back, okay? But that doesn't do anything for this thing, right? Your head, which is the most important factor, it doesn't do anything to actually fix the curve in your neck. It's not touching your neck. It doesn't have anything to do with it. It's literally only pulling your shoulders back. But why does it still sell? Why do these things still sell? Because like he was talking about, so many people walk around like this. So what do we do based, what is our determining factor on what we do in health? I talked about it earlier. It's based on what we can see. So you see a bunch of people walking around like this, maybe not this bad, but a lot like this, right? And then you see people wearing a posture brace that's making them do this. Which one stands out to you, right? So all of a sudden, all the masses think, oh, well, look at that. They're standing up so much straighter because you can actually see their chest, right? So, but the reality is they don't work. They just don't work. So, we looked at all those things out there. The Posture Guardian, that's the one that is here, is the most advanced posture training device on the market because I made it. That's jokes aside. But literally, it's because it's going based on the model of the spine, based on the important factors. So the starting point was we have to have a device that actually pulls on the lower cervical curve into that C shape, right? You've got to pull that into that C shape. Then, yes, some force around the shoulders to pull you back here, and then it's got to cross over in the back and do something for the lower back too, right? So this is the only device on the market that actually affects all of those, but it still has to be over time. Time is a dependent factor in every single case. All right, so that is it. Does anybody have any questions on anything?
How do you strengthen those muscles in the knees and or make sure your knees are lined up? Is that something y'all do and you just x-ray it?
So there that's a multi-pronged answer, if you will, because the first thing is, of course, in just general, you can't really fix, it's like what he talked about. You can't fix knee problems until you fix what the knee's attached to. Okay? What does everything in the body attach to? The spine, right? That is your core.
Right.
That's why we call it the core. Mm-hmm. So until you fix the spine and correct this, then your knees are not going to be fixable, right? Now, if you have specific knee problems like, you've injured a ACL or a meniscus or something like that, something more on that level, the good news is he's fixed or had every knee injury that you could possibly have just about, so because he's had to deal with all those injuries himself, he knows all the recipes on dealing with those specific exercises.
There was a time where we'd go play pickup soccer, and I'd be out for like a week. I couldn't walk. I'd be in here like limping around. Eventually, I was like, "This is not how it's supposed to be." And I think Jordan Rubin as well. You talk about him having knee issues. You need to demand more from your knee and full knee range of motion after the back is fixed. So I had a decent low back curve at that point, and I found a bunch of knee specific exercises. Like backwards walking on a treadmill without turning it on, for example, puts your knee over your toe, and you're pushing that belt. You can do it with a sled. You can backwards walk with a sled. you're really training the kneecap to sit more in midline, right? And so that it's not constantly rubbing up against the tibia, causing the knee pain. A lot of times we see like runner's knee and jumper's knee. But yeah, once you correct the back, a lot of times it's just a matter of demanding more from your knee. And the soft tissues do strengthen. They take about 12 weeks in the knee, but they definitely can. And I've ran my first marathon, training for 100K in August, and we play soccer competitively still. So I was like down here, and so we're making a recovery.
Yeah, it was Ben Lerner. So Dr. Ben Lerner, old colleague of mine, he tore up his knees in college wrestling. Like he wrestled top divisions, all the way through, almost made it to Olympic level and everything. But by the time he was in college, his knees were shot. And they said that he was going to have knee replacements by the time he was like 30. And so he just battled with, degenerative knees and everything else. But being a chiropractor and being stubborn as we are, he decided, you know what, I don't really believe that. So I'm going to start creating a demand of the tissues, and I'm going to see how my body adapts to it. And so he started running, and he started running more. And like Forrest Gump, he kept running more and more until he got to the point where he was running marathons and then Ironmans and, and all this, just ridiculous mileage on knees that were supposed to be having to be replaced by the time he was 30. And this was at about 50. So, it's just absurd how much the body will rebuild something if you create a demand for it. But I guess the moral of the story is your body will listen to what you tell it, right? In all cases, your body will listen to what you tell it. So if our lifestyle is, no matter what that is, in any situation, hey, there's the lights. Bye, guys. We know what time it is. It's 8 o'clock. Okay, so if you, if your lifestyle is telling you that we're probably gonna, do very little activity today, as I was talking to a patient earlier, the typical, even guy's lifestyle nowadays is get up out of the bed, go get in the car, go sit at a desk, get back in the car, go sit on the couch, get back in the bed, right? That's the activity level. And then we wonder why testosterone goes through the floor, or we wonder why we start gaining weight, or whatever else it is, or developing knee problems, like you said, with your legs just hanging there all day long. If we're not creating a usage, the body is not going to exert energy in order to build, right? Because it doesn't need to. Your body is remarkable in its adaptive abilities to adapt to its environment and adapt to the conditions that you put it into, right? So it's never going to do anything inefficiently. So if from an efficiency standpoint, it is conserve energy, store fat, whatever it is, it's going to do that. But the second you create a demand on any tissue in the body, it doesn't know what no means. Okay, so I talk about this a lot when we talk about exercise. If I go over and I push on this wall, you might consciously know I can't push through that wall. But does my brain know that? No. My brain feels that I'm pushing against an object that is not moving. And so it's going to immediately go to work to try to adapt to where the next time I meet that demand, I can do it. And there's no limit to that, which is no real limit to that outside of, the laws of physics. That's why bodybuilders can get so massive. They can go from little skinny dudes to just looking like monsters, right? Because the body will continue to adapt as long as you create an increasing demand. It's remarkable. So all of us can use that to adapt to whatever we want to become, whatever.
Yeah. Your body will sacrifice biomechanics for the sake of energy preservation. So I talk about all the time with patients. If you're picking something off the floor, you're not thinking, okay, hip hinge, spin at the waist and everything. You're just gonna reach over and pick it up. Yeah, unfortunately, that's the case of a lot of slip disc as well. Mm-hmm. Just weeding in a garden, for example, picking up, pulling, because the body was trying to save energy and not necessarily do its best for itself.
Or we do no gardening for months and months and months on end and then try to do it all in one day. And you exceed the capacity, right? All right, any other questions? Nope. All right, if you guys do have any other questions, of course, you guys see us plenty, you know, so ask away. We're here to answer. If there's any questions from YouTube or anything like that, of course, post them in the comments. You know, we'll try our best to answer anything that comes through. Legitimate questions, of course. So have a great night. Thank you guys for coming. And if you need to pick up anything on the way out, you can see Faith. All right.